Sounds
Esta
good.
es la reunión de...
También lo viste a Omar, lo viste en el PBS.
Ajá.
Y
Castillo mío, o lo viste en internet.
Ujú. Ah, en Facebook, que ya lo puso.
good afternoon, everybody. This is Simeon Russell, the executive officer of the Maryland Head Start Association. We're going to go ahead and get started. Um, I have some resources that I'd like to share for you before we introduce our guests and get started with our guest. Now, I'm going to be very short today because I want to save enough time for our guests to get through their presentations and have a question and answer session. Um, I want to bring light to an email that I sent earlier, and I just sent it probably 20 minutes ago. That has a host of resources that have come to me over the last couple of days. So I got it out to you all. All right. The first thing that's in there, though, is a draft of the strategic plan that I'm working on. Oh, not me, but MHSA is working on with the Maryland State Department of Education. This is a draft form, and we'd like to get your input. And I'm going to show it up on the screen, although I'm not going to go through it in any kind of detail. I just want to let you see what it looks like so that you're familiar with it. This is the same, we work on this every single year. Obviously, this year, we've done a lot of updates in response to COVID-19. And all of the updates are in red. I'm going to skip through some of the data information, and I'm just going to get to, so that you can see some of the red parts. All right. You can see here, under let me at least say this. There are 5 priorities that we work on with the Maryland State Department of Education and the Head Start State Collaboration Office. All right, those 5 priorities are to partner with the state child care systems, emphasizing the Early Head Start Child Care Partnership Initiative. We work with the state efforts to collect data regarding early childhood programs and child outcomes. Number 3 is to support the expansion and access for high quality workforce and career development opportunities for staff. Number 4 is collaborate with state quality improvement systems. And number 5 is work with the state school systems to ensure continuity between Head Start and kindergarten readiness assessment. So in each one of these areas, we have some updates in response to COVID-19. And those updates, again, are in red. And then we have regional priorities. And of course, our regional priorities are totally evolve around COVID-19 in response to COVID-19. So what I'm asking you to do, directors, is take a look at everything in red. You can look at the other stuff as well, but in red is what I'm asking you to pay attention to. All right, pay attention to everything that's in red, because those are some of the new needs, and the needs relate to some of the strategies to address those needs. All right, this is in your email, and I'm just asking you to take a look. If you have ideas that are not in there, or if you see something that's wrong or something that needs to be fixed, let me know. Send me an email. All right, send me an email. You'll see there's a lot of red because there's, with COVID-19, there's a lot to respond to, especially when we get to the regional priorities. And I'm going to skip down to the regional priorities now. When we get down to those regional priorities, it's almost totally revamped in response to COVID-19. And our regional priority is health and well-being, which covers a lot of stuff. And so we have a lot of things written into the regional priority. So we're asking you to please take a look and give us your feedback, all right, especially in the area, in the regional priority, in the area where we do the regional priorities. As you can see, I'm here now, and you can see this entire thing is in red because it's new. All right, these are new strategies and new goals. So please take a look at that and give me some feedback. send me some, email me with all the information. Okay. And anyone who did not receive the email, you can put it in the chat and I'll make sure that you get the email. If you did not receive the email, then I may not have your email. Put your email in the chat and I'll make sure that I send it to you. Other things that are in that email, there's a document and it's up on the screen now from Lakeshore that gives you an example of what a social distancing classroom could look like. And in that email, there's also an attachment of supplies for a classroom, the size of 10 and under. All right, but that's just an example of what a classroom could look like. That's from Lakeshore. There's also a resource on toothbrushing in COVID-19. All right, so please take a look at that. And I also have some information about a webinar for SNAP and pandemic EBT benefits. And there are attachments, flyer attachments in Spanish and in English. All right, so please take a look for that email. The subject line of the email is MSDE strategic plan and important resources. So take a look at that and some of the resources that are in there. There's also a link to family supports and remote service delivery resources. All right, so there's a link there as well, link to that as well. And I can actually bring that link up real quick so that you can see what that is in the event that you have not received it, aware of it before this. All right, it says communication and connectivity, family supports for remote service delivery. So there's some good resources here that you can use. And this is, of course, from the Office of Head Start. All right, so in the event that you have not received that or in any other location, it is in that email. All right, and if you come across resources, please let me know, email it to me so that I can send it out to everyone. The resource that I put up on the screen about the social distanced classroom, Ms. Teresa Booker sent it to me from Calvert County. Thank you very much. So please, if you have those type of resources, send it to me so I can get it out to everyone and get it on our website and those type of things. All right. But that's really it for me now. I want to get to our presenters and make sure that I save enough time for them. I just want to reiterate, please take a look at that strategic plan and all the other resources and send me some feedback on that strategic plan. And, we'll be able to take a look at that plan a little bit deeper later on as we continue to build out the strategies that we're going to need in response to COVID-19 and reentry and all of those good things. All right. So without further delay, I would like to introduce Ms. Cheryl DePinto, and hopefully, Mr. Pinto, I said your name correctly. Mr. Pinto is the director of the Office of Population Health Improvement from the Maryland Department of Health. And I am going to unmute you so that you can. Oh, you're already unmuted. Good. Cheryl,
I muted myself. I just need you to share my screen.
Yeah, I am working on that now. I'm going to make you the presenter, and then you can take over from there. All right. I just made you the presenter.
Perfect. Now let me Bear with me 1 second. There we go. So can you all see my screen?
Yes.
Okay, perfect. Okay, great. So first of all, thank you for allowing me to have the opportunity to come and speak with you all today. As Simeon already mentioned, I'm Cheryl DePinto from the Office of Population Health Improvement at the Maryland Department of Health, and I am a pediatrician. I have worked in the area of school health for a very, very long time. And during this COVID time, I have been one of the clinical consultants to MSDE related to childcare issues during COVID. I also want to bring to everyone's attention that I have one of my colleagues, Dr. Jamie Perry, also joining me on this call today, and she will be chiming in and also assisting with answering any questions that you may have at the end of the presentation. So what I'd like to do today is to go over some of the guidance that we have developed as it relates to responding to COVID within childcare settings. The guidelines that we have developed for childcare have all been based on CDC guidance, based on what we know and understand about the science around the COVID-19 virus. And as Simeon went through that document to show everything that was in red, my eyes picked up on a few things that that I think some of these guidelines can address when it comes to health and safety issues. All right, so some of the topics that we have addressed in our guidelines are listed here. We talk about COVID-19 case reporting and communication processes. We have guidance regarding persons who are over 65 years of age or with underlying health conditions who may be working in a child care setting, and instructions for them to consult with their healthcare provider. We have guidance related to temperature checks and symptom screening of children and staff when they enter the programs, social distancing, cleaning. One of the other questions we got a lot was around playground use, so we have some guidance around that and how to respond to a positive case or a presumed case when it comes to issues around cleaning and whether or not the site should be closed. So we have, again, specific guidance around closure and reopening, guidance around quarantine and isolation when it comes to people who have potentially been exposed or who are infected with the COVID-19 virus. We have a specific guidance around the use of cloth face coverings, guidance around limiting outside persons in the building, and guidance related to cohorting of children and staff in groups with limits of 10 persons per room. And the link that you see here on the screen from the Early Childhood Division at MSDE contains all of the different guidance documents. Much of the guidance that I talked about has to do, is contained in our frequently asked questions document, but there are certain standalone guidance documents, and those are the more complicated, the more extensive guidance that have standalone documents, and some of those guidance documents are the ones that I will be going over today. So one of the things around communication, this is tied partially to the screening around illness when children arrive to their childcare site in the morning. But our guidance talks about the need to encourage parents to report illness within their household, within their children and themselves when they drop off their children, in order to inform decisions related to either site closure or related to exclusion of a child were they to have symptoms that could be consistent with COVID-19. We also say that child care administrators should monitor absences amongst children and staff according to CDC guidance, and that way child care administrators would know not only if a child was out because they were ill, but also out because of some other reason that may have nothing to do with COVID-19. because absence from a building also plays into decisions around the timing and timeline for a child care closure or reopening. Also, providing information regarding absences due to COVID-19 symptoms will assist child care programs when they consult with local health departments to get recommendations from the health department regarding whether or not a program may need to close. Now, the first specific guidance that has a standalone document is a guidance around temperature checks and symptom screening. So as everyone probably has heard out in the media or in any other guidance documents, the idea of checking temperatures is one of the very common procedures that is being done to make decisions about whether people can enter a particular building or not. And there was quite a lot of discussion about what's the best way to do this in a childcare setting. So right now, our guidance states that the parents are checking the child's temperature while being directly observed by the child care program staff while maintaining social distancing. And the parent is checking the child's temperature with the thermometer that they have provided from home. And then in addition to the child's parent or guardian checking their child's temperature, child care program staff should wear cloth face coverings as well as the parents while they are engaging in this temperature screening. Once the child's temperature is checked by their parent or guardian, they should show that temperature to the program staff so they can record it in their recording documents. Now, if the family does not have a personal thermometer for the child, the parent guardian can use a thermometer that's provided by the child care program, and we're recommending non-contact thermometers, but an ear thermometer or a temporal thermometer can also be used following appropriate cleaning and disinfection procedures according to the CDC recommendations. In this scenario, the parent and child would, the child's parent would perform the temperature check following appropriate hand hygiene and use of a glove prior to the child's taking the child's temperature, and then they would report that temperature to the child care staff, return the thermometer to the child care staff person for cleaning. Any child with a fever over 100.4, greater than or equal to 100.4 actually, or any other signs of illness, or who have a person in their household who may have symptoms of COVID-19 should not be admitted to the child care facility. When it comes to the staff, all program staff should also be monitoring their temperature at home and report their temperature to the child care center upon arrival to the facility. If they did not take their temperature at home, they can use the thermometer provided by the child care center and use the same procedure as is used for children. Child care program staff should, again, not enter the facility if they have a fever of 100.4 or greater, or any other symptoms of COVID-19. In addition to the temperature checks, the parents and guardians would be asked questions related to symptoms of COVID-19 or whether or not any persons in their household has symptoms of COVID-19. The reason that this is really important is that, especially for children, there's a large number of children who may have COVID-19 but who do not have a fever. Also, there are adults who do not have a fever as well, but absence of a fever is more common in children. There are also quite a number of symptoms of COVID-19, especially symptoms that are very common in children, such as gastroenterology or gastroenteric type symptoms of nausea, vomiting, or diarrhea. They also often may not have a cough, which is one of the common symptoms in adults. And so the tracking form that we have developed has got the list of symptoms that parents need to be asked as to whether or not they or anyone in their household has these symptoms. And if they do, the child may not be admitted to the child care facility. And the same would go for staff, that if they have any of these symptoms, they may not enter the facility. As I mentioned, there's a tool and a resource that is available on that MSDE website. There's a script for conducting temperature and symptom screenings, as well as a log that can be reproduced for daily screening for children and staff. Now, if there's a possible case, a child care program should immediately begin the process to close their center for a brief period of time and contact the local health department and licensing specialist for additional information. The licensing specialists now are working with the health departments and the child care programs regarding communication about closure, assessment of illness amongst other people who may have been in contact with the person who is ill, cleaning procedures, and decisions around reopening. Any child who has a household contact who has symptoms of COVID-19 would have to be excluded, and the child or the child care staff member would have to be quarantined at home for 14 days to observe as to whether or not they develop symptoms. In addition, we are asking the child care programs to contact the local health department for guidance regarding whether or not they need to close, and who in the program would need to be quarantined if they have had contact with other people who are in the building. Now, what you see here on the screen is our current closure guidance. So for the purposes of this guidance, a probable case of COVID-19 is a person who could be a child care staff member, a child, or any other person with symptoms of COVID-19, regardless of whether they have been tested or whether or not the test results are known. So a child care program would need to close if there's a laboratory confirmed case of COVID-19 or a probable case of someone who was present in the program building within 48 hours prior to developing symptoms and had close prolonged contact as defined by the CDC with program staff or children, or if there's a laboratory confirmed case of a person with COVID-19 but they are asymptomatic, but they were tested for a reason that the child care staff other child care staff may not necessarily be aware of, but that person was present in the child care program building and had close prolonged contact with program staff or children. One thing that is of note is that for family child care sites, if the person with confirmed or COVID-19 is a parent or other household member of a child in care, and the only person they had close contact with was their own child who is in the program, they may not be required to close if the child is asymptomatic. And actually, I said family child care, and I meant for centers. So they may not need to close if that one child is the only child that the other person had contact with. One question that we get a lot is that if, especially early on when child care was for essential workers, many of who may be healthcare providers, whether or not there was a risk of parents exposing children. So we are having centers take a lot of measures to limit the exposure from parents and other adults into the program. So we're having them do their drop-off and pickup procedures either outside or in a small common area and not enter the child care program space. We are also saying that during drop-off and pickup, as I mentioned before, with temperature checks and symptom screening, we are recommending the use of cloth face coverings, and that local health departments and licensing specialists ask about what measures are being taken as part of a program. One other part of our guidance that's very important is that should a program need to close, the reopening decision and other information that gets communicated to families within those programs may be dependent upon the status of the attendees of the program or other staff during the time that they're closed. So we felt that it was very important for child care programs to be checking in with staff and child care families and to report to the health department if any additional people become symptomatic during the time that the child care site is closed. And then also if the childcare site is closed, but they're waiting for a COVID-19 test result, if the test result is negative, then they may be able to reopen sooner than the 14-day period. And for this slide, just to go just very, very briefly, the length of time for closure is determined in consultation with the local health department. There are sometimes specific situations where the closure can be less than 14 days. It may be need to be greater than 14 days. And the communication processes are really what makes the determination about the length of closure. Now, the next topic that we have a very specific standalone guideline about is the use of cloth face coverings in childcare. Now, both the Department of Health and MSDE have developed recommendations for the use of cloth face coverings based on the CDC guidance. And our recommendations include that adults should use cloth face coverings throughout the day while they are working in a childcare center. Child care staff and parents should use cloth face coverings during drop-off and pickup. And we're recommending that children age 5 and older wear a cloth face covering while they are in childcare when this can be accomplished safely and consistently. And in our guidance document, we have a number of different criteria that kind of defines what safely and consistently means. What's important is that cloth face covering should not be placed on children under the age of 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. And what's important about that last criteria about unable to remove the mask without assistance is that in our guidelines, we take a very strong developmental approach in the sense that not all children over the age of 5 may necessarily be able to do this safely and be able to remove the mask on their own. So if they are not able to do that without assistance, then they should not be wearing a cloth face covering. We have, again, in our guidelines, some very specific statements about when the cloth face covering should be removed. And again, you see here that the cloth face covering should be removed if a child is not able to maintain the covering on their face and they keep trying to touch it, and that becomes an unsafe situation. So for those children who are not able to wear it without touching their face frequently, they should not wear a cloth face covering. Cloth face covering should not be worn while children are napping, and they should not be worn around their neck or over their head. On this slide, it just talks about, again, some additional safety precautions: no attachments, not worn during certain activities, such as if they're running around outside, not wearing cloth face coverings while napping, and a child should never be forced to wear one if it's uncomfortable and they cannot do so safely. And so, as I mentioned, the link that was on one of the previous slides has all of the guidelines that we have for childcare. And as you all know, there's quite a big planning effort going on right now related to reopening of schools. And some of the guidance that we have in place for childcare may translate into the school setting, may translate into a variety of early childhood settings. And we are reconsidering all of this guidance when it comes to the public school pre-K programs. And so hopefully some of these guidance documents, as you read through that other plan that Simeon shared, that you can be thinking about these guidance documents as well, and let us know if you have any questions or things that we can be of help to you all regarding in terms of answering any additional health and safety questions that you may have. So with that, I'm going to stop my presentation, and I'm happy to answer any questions that you may have.
And I just unmuted everyone so that if you have questions, you can feel free to ask questions.
Hi, this is Shannon Burroughs Campbell. Thank you, Cheryl, for the information. I am really curious. I had read early on that face coverings were going to be were recommended, especially for the avoiding any type of the mucous membrane. Has that guidance changed?
No, that guidance has not changed. And there actually is likely to be some additional guidance that comes out related to the types of masks and situations where certain types of masks, such as surgical masks, may need to be worn in certain types of settings with children who have specific health conditions where there may be a greater likelihood of a staff member or other children coming in contact with the patient. But for right now, our guidance is about cloth face coverings, the same type that are being encouraged to be worn by adults and that are required to be worn in our state in retail and other public establishments. And so there, as you mentioned, for additional recommendations, they would be forthcoming as part of the school reopening plan, and we have been in communication with the school health services coordinators to address issues such as the one that you brought up.
Any other questions?
This is Angelo Knox, Discovery Station Early Head Start Program. Is this presentation available to be sent to us via email?
Sure. Actually, what I think that we may do is we can post it on the website. I can ask MSDE to post it. But just to reiterate, everything that was on these slides is contained in the documents that are already posted on the website. I can also let you know that there is another slide deck that is being developed and being scripted out that will be used for training purposes that has even more detail in it than what this presentation did. I don't know exactly what the timeline for that is, but I would say that we could share these slides, but also you can look at the guidance and you can look forward to a more in-depth training slide deck in the next couple of weeks, I think.
Okay, thank you.
Dr. DePinto, has anybody kind of gone through the procedure for arriving at the center to see kind of how much time it's going to take in the morning?
So the answer is yes, but in terms of how much time it takes, that I do not know. Currently, for the child care sites that are open for essential workers, and now there's even more coming online for workers in businesses that are authorized by the governor's executive order to be allowed to be opened. They are following these procedures now, and they have been following them since the new configuration of childcare was put in place. And so these procedures are being followed, and I think that maybe we can ask the licensing specialist to find out from the child care providers how long that process takes. But one of the guidance documents that I did not, or one of the guidelines that I did not really go over, was the guideline around social distancing. And in our FAQ document, there's quite a long list of strategies to promote social distancing in childcare sites. And one of those strategies is to stagger arrival and drop off and times to address that issue of not having too many people waiting in line to drop their child off and to give them time to go through these screening procedures. So we're trying to be mindful of the fact that it does take a long time to go through this process, and social distancing by staggering should help with that concern.
Hi, I have a question. This is Corey Bowman from Head Start and Shore Up Incorporated, and I have a question, I guess, with regard to the a few questions. But our first question: we're at Center Head Start Center that provides transportation. So, is there any discussion on guidance for school bus situations And if the children are being dropped off by bus, of course, we wouldn't have the parents there, to take temperature. So we'd be looking at an influx of children coming in at one time off the buses.
So that situation is also under discussion with the school health staff. We do recognize that when children are taking a school bus, that it is obviously not the parent who can take the temperature, and that it is a time burden on the school to do that. So we are in the process of developing some guidelines around that. What I can tell you is that there are documents that I've seen for either childcare or for schools that suggest that the parents should be reporting the temperatures prior to the child getting on the school bus. And there are a number of technology solutions that are being proposed either through text messaging or through online systems, or even possibly phone calling. But what you would want to avoid is that if a child had a fever in the morning or had symptoms, you would want to avoid them getting on the bus to begin with.
Right. Okay. And I guess my next question goes back to the guidelines for the number of children in the classroom. That number was 10, and that is including the staff person. Is that correct?
Yes. So right now for childcare, the ratio is 9 children with 1 teacher. And if for some reason, based on either the age of the children or any other aspect of their needs, if there were 2 teachers, then it would be only 8 children. So we're going by the current recommended group size, which is coming from both the governor's executive order around mass gatherings, as well as the current CDC recommendations for limiting group size.
Okay, right, and because that's going to have tremendous impact on us with Head Start programs, with our average class sizes being, as far as 17 to 20. So that leaves us trying to figure out how we determine who does and does not return, or how we will provide services throughout the day for the entire class.
Yes, you're absolutely right. And I do believe that if you were to look at the recovery plan for resuming in-person education that is put out by MSDE, in that larger document related to all local school system considerations, one of the things that's in there has to do with how to reduce the number of children in the classroom. And there are a variety of different strategies that are in that document, ranging from morning students and afternoon students, A day, B day students. And so I would urge you to take a look at that and see, again, what strategies may be possible. The other thing is that I'm not 100% certain the way in which your Head Start programs intersect with the public schools. So, but I would also recommend that you consult with the local school boards and the local school health staff who are helping to inform those decisions, to see if there are any strategies that they are planning for the K-12 programs that you can also implement in your Head Start programs.
Okay, thank you.
There's one more question here in the chat, and then I guess after this question, if you have other questions, you can send them to me, or you can email Ms. Pinto to ask those questions. But if you do that, I'd like to, whatever the question is, at least get that answer so that I can send it out to, get the question and the answer so I can send it out to everyone as it may pertain to everyone else. Alexandra asked a question. She said, although I understand this is for childcare, are any of these procedures also being considered for home visit procedures for those programs who offer home-based services?
So the answer is yes. And I don't have in my mind the exact place where this document can be found, but there are guidance documents for home visitors that I believe is on the Maryland Department of Health website. But in addition to that, the Maryland Department of Health is in the process of looking at getting information from people who have concerns about home visiting programs, community health worker programs, and other types of programs to address their concerns, to identify appropriate procedures. So what I can do is I can get the link for the document that currently exists, and then I can also let you know who in our home visiting program at MDH can provide you additional information on what they're doing in terms of developing those guidelines and standards moving forward.
Okay. Okay. All right. Well, Cheryl, thank you very much for the presentation, and I feel like maybe there's definitely going to be more questions that come to you through email, or if they come to me, I'll send them to you. And we look forward to having you back, because I'm pretty sure we're going to have to continue to stay updated. You know, we're going to continue to have questions as we plan and set up plans to reopen.
Yes, well, thank you so much for having me, and I would be happy to receive any email questions that you may have.
And
Okay.
Cheryl, you had an ask for us. You wanted to ask the directors quickly if they could give you health managers, get together with them to brainstorm about children not keeping their well visit.
Oh, yes. So, yes, thank you, Chris, for reminding me about that. So one of the other things that has been a concern related to this COVID pandemic is the unintended consequence of children missing their well child visits, and specifically missing receiving their vaccinations. And so what we are anticipating is that in the fall, if nothing changes between now and then, there's going to be quite a large number of children who are not going to be up to date on their vaccinations. So we're in the process of trying to get information out to families and information out to programs to remind them of the ways that, remind them of the importance of getting their children vaccinated, but also provide them resources for a variety of ways that they can get their children's vaccinations up to date. And so what I would like to do is provide you all the link to the FAQ document so that you can begin to reach out to your families related to this issue. And then again, I would welcome the opportunity to speak with your health directors to strategize not only about that issue, but also to discuss any other health and safety issues that are relevant to Head Start programs that need further discussion.
Great. That's great. Thank you. And I'm sure oral health is in the same boat, if you would, of making sure the children are keeping up with their oral health too.
Yes, they would be in the same situation. What I would say, though, is that vaccination has a sense of urgency from the standpoint that we're trying to make sure that we don't have outbreaks of vaccine preventable diseases. And the level of decreased vaccination being, well over 50, 60, and in some cases 80% for certain vaccinations is quite significant and could create another public health crisis if we don't address it very, very soon.
Right. We'll follow up and see what we can do on that one too. Thanks so much for coming out and talking to us, and we look forward to seeing you again or hearing you again.
Great. Well, thank you all so much. Have a good rest of your day.
Okay, thank you. Thank you very much. Again, please email me any questions, or Cheryl any questions, and we'll make sure that we talk to each other, and then we'll get those questions and answers out to everybody else. So now I would like to hand the controls over to Ms. Anna Putnam, and she is going to present to us about domestic violence and children during COVID-19. This should be very interesting. Please pay attention, and it is being recorded so that I'll be able to, so that you'll be able to go back and look at it. Write down any questions that you have, so we'll have some time at the end. You'll be able to ask any questions. But without further ado, Anna, you got it.
Hello, thanks again for having me back. Let me move this over so I can make the slideshow big. There we go. Okay, so I'm going to talk about domestic violence very, very briefly. It could be a full several-hour training, as I'm sure you all know, so it's just touching the surface. So generally speaking, thinking about children who have experienced or witnessed domestic violence, they may be fearful, anxious, really slow to trust other adults. In the classroom, you might see regression of skills or slow, like children are slow to develop skills that have previously been mastered. So bedwetting, thumb sucking, clinginess, things like that. They may have difficulty falling asleep or staying asleep. They may show signs of terror, like stuttering, hiding, not wanting to be close to other adults or other people. And they may show signs of severe separation anxiety from family members. It's important to keep in mind that many children who are exposed to domestic violence are also victims of physical or sexual abuse themselves. So it really, all in all, children who have experienced domestic violence have really endured a significant trauma. And there's many different possible effects and responses that a child might have. So you're really going to want to use a trauma-informed approach and take it slow and cautious. In terms of domestic violence as it relates to COVID, avoiding public spaces and working remotely we've found to be really great at limiting the spread of COVID, but it is not great for domestic violence. Staying home may not be the safest option for a lot of families. And we also know that any sort of external factors that add stress and financial strain can negatively impact the family that's in crisis and make things even more unsafe. And this is definitely a situation where we are stressed out and a lot of families are experiencing that financial stress. Abuse in general is about power and control. And so when survivors are forced to stay in their home or in close proximity to their abuser more frequently, including during times like these, the abuser is really able to use this situation as a tool to exert more control over their victim. At a time when social distancing is encouraged, when we're working from home a lot more often, and just public places are not as readily open or available, an abuser may take advantage of that situation to really exert more control or abuse. So specifically speaking, abusive partners may withhold items like hand sanitizer, disinfectants, face masks, things that are really important right now for staying healthy and well. They might also limit access to medical care or medical insurance. Abusive partners may share incorrect information or misinformation about the pandemic to control or frighten survivors. They may prevent individuals from seeking appropriate medical attention if they have COVID symptoms. They may also use it as a sort of a tool to keep you away from your loved ones. So there's COVID right now, you can't go see your children, or you shouldn't go see your mom right now, which is really true in a sense that we shouldn't be, spending as much time with people, but at the same time, if your safety at play, that's more important. Survivors may be hesitant right now about getting help from public spaces that they would typically get support. So places like shelters, counseling centers, courthouses, for fear of exposure, for fear of getting sick. It's also the case that many of these services have reduced hours, they have limited services, or are closed altogether right now. And then travel restrictions may also impact a survivor's escape plan or their safety plan. And sort of all of these pieces, all of these stressors that we're experiencing right now means that an abusive partner may feel more justified and escalate their isolation tactics. In terms of looking forward to when we are back in the classroom, how you all can support your children that have experienced or witnessed domestic violence. Kids do best when they have a predictable, consistent routine because it makes them feel safe. So as much as you can encourage your teachers and your classrooms to keep that schedule is really important. Some children might want to hold on to a comforting object, like a favorite toy from home or maybe a favorite toy in the classroom, and that's really going to help them feel comfortable in that space. And then make sure you're utilizing your cozy corner, maybe as a place to talk about feelings, to talk about their experiences, and also as sort of a safe place for a child to retreat to if they start to feel overwhelmed by what's going on in the classroom. As much as you're able, provide access to expressive activities like painting, drawing, theater, poetry, music. These activities provide a space for children to process their feelings and process their trauma that they've experienced. Talk with your children about physical boundaries. I'm sure that this is part of your curriculum. I'm pretty sure I was in a classroom one time when you were having this conversation, but I'm just going to reinforce that it's really important to sort of talk about how no one has the right to make them feel uncomfortable or hurt them. Sort of teaching consent at this age is really important, that we should ask before we give hugs, before we do high fives or any other kind of touch. And teaching kids that it's okay to say, no, thank you, I don't want to be touched right now. If a child does open up to you about what they've experienced at home, give them space to talk about it, you know, be present with them. Provide reassurance often is important, that it's not their fault, that they haven't done anything wrong. And then of course report to Child Protective Services if that is deemed appropriate. In terms of supporting the adults in a child's life that may be experiencing domestic violence, it's a good idea to provide resources to all of your families so that no one feels singled out. It's also the case that you never know what might be happening behind closed doors. So it's good to sort of give those resources to everyone. And then if you are concerned about a family or an individual that might be in an unsafe situation, just keep in mind that it takes a lot of courage and a lot of planning to leave an abusive relationship, especially at a time right now. So just be as patient and gentle as you can in sort of supporting that person, but also meeting them where they're at, because maybe they're not in a place where they're ready to leave. In terms of some resources, I've listed information for the National Domestic Violence Hotline. They have a phone number you can call. They have a website that you can log on to and get a whole bunch of information, as well as the old school like email chat with someone. And then you can text. There's a phone number on there that you can text for help as well. In terms of local resources, these centers are all still open right now. Some of them have limited services, but the shelters are all still open. So there's Family Crisis Center of Baltimore County, Turnaround, and then House of Ruth, Maryland. And as a side note, Turnaround provides support for domestic violence as well as sexual violence and human trafficking. So if you're worried about any of those things, that's a great place to go to. And then here is my contact information. Any questions or thoughts?
You are unmuted, so you can just go ahead and unmute yourself and speak up, or if you're already unmuted, ask a question. I'm going to check the chat. I don't see any questions in the chat. Well, if you have questions later on, please make sure that you email me, or you can email Anna.
Absolutely. Zoom.
And I do have this slideshow, so I'll send the slideshow to everyone so that you have it, and we'll have her contact information on the slideshow.
Okay. Shoot.
Okay. Well, Anna, thank you very much.
Absolutely. Thank you.
All right. Thank you. And ladies and gentlemen, I know it's 3:25. I thank you all for staying on. And this has been recorded, so I will be able to. I will send out the link with the recording, and I'll break it down so you can have each one of those meetings separately if we need to as well. Please contact your health managers. We are going to look to set up a time that the health managers can meet with Mr. Pinto, and of course you can be there as well, so that we can have a good discussion with everyone. I'll speak with Mr. Pinto to find out the best time, and I'll speak with you and coordinate times. Okay, so if there are no more comments, feedbacks, or questions, I know.
Selena, I have a question.
Yeah.
This is Tressa. I was wondering if anybody had received or been denied reimbursement for food from the Child and Adult Care Food Program.
Yes, they have. Matter of fact, Angelo is on, and I think Angelo, can you hear me? You can.
Yeah. Okay. Family Services. Anybody else? And I know about you from Jody. Thank you for being here.
No problem.
Anybody else put in a claim or?
Hi, Tressa, this is Corey. I didn't understand. Can you repeat your question? I didn't understand the question that you asked.
I was wondering if anybody put in a reimbursement with the Child and Adult Care Food Program for meals they've been serving during the COVID-19 crisis and either received that reimbursement or been denied that reimbursement. Or anybody put in for reimbursement?
Okay. No, we did not do that.
Okay. Shannon, did you?
Tressa, I was going to say, if you wanted to, Angelo's going to stay on for a couple minutes after this meeting with me. If you wanted to stay on for a couple minutes,
Okay, that sounds good.
Details.
Okay, sounds good. Thank you all so much.
Okay.
Hey, Simeon, can I hang up for a minute? I want to ask Tressa a couple other questions too.
Okay.
All right.
All right, everybody. Thank you very much. And I'm going to stay on for a couple minutes with Angelo and Tressa, and look forward to speaking to you guys soon.
Hey, Tressa, thank you for staying behind. Basically, we submitted our April CACFP claim, and it was denied. And we submitted it based on the non-congregate feeding waiver that basically says as long as you are a program utilizing CACFP, that you're still able to submit. So we still provide food to our families. We have family support staff that drops off food to the families using the guidelines for meals for CACFP. I believe it's breakfast and snack that we're providing to our families right now.
And Angelo, tell me the name of the waiver again. It was non-congregate.
Non-congregate feeding waiver.
Feeding.
Yes.
Okay, I knew about that, and then the food program was saying that the Office of Child Care said no because only the Epic Centers could be open. So we're going to have a meeting with them to figure out what we can do to fix this situation, because I don't think that was the intent of the U.S. Department of Agriculture or the Office of Head Start to deny
Right.
the funding for food. So anyway,
who did you say you were going to have a meeting with?
At the MSDE building with the Division of Food and Nutrition.
Okay.
So I've gotten two different reasons that they said they denied it. One was based on something from Child and Adult Care Food Program. The other one said based on what the Office of Child Care says. So I'm like, can't be two things, and
right.
To do to fix whatever it is that's not fixed.
Right, especially with the guidance that came out saying that it was acceptable for us to be able to do it as well. So we were kind of surprised.
Just trying to figure out, what needs to be done to get this going.
Okay. If you could, do you have your meeting scheduled already by any chance?
No, I just emailed them today, so I'll let you know how it goes. And I have a copy of the, Jody sent me a copy of your denial, and Pat sent me a copy of a note that she got, Pat Foley in Carroll County. So I have copies of the emails where you got the denial for it. So
Okay, yeah, because our compliance officer had sent a couple emails. And I think it was Robin Ziegler who actually signed off on that memo about it.
Right.
So our compliance officer sent an email to Robin, but we haven't heard anything back. So I definitely appreciate you letting me know the outcome once you're finished with that.
yeah, so once we're done, we'll see what needs to be done. Hopefully.
Okay. Well, I appreciate it. Thank you so much. And Simeon, thank you as well.
No
All right.
problem.
You enjoy the rest of your day.
You too.
All right.
Thanks, you too.
Hey, Tressa, this is Corey.
Hey, Corey, how's it going? We left in the
I'm
middle of
doing
chaos.
well.
We closed the world.
Yeah, doing well, doing well. So my question / concern is I'm really